The London Regional Cancer Program is one of the busiest programs at London Health Sciences Centre. It serves a regional community with a population of over 1 million people.
One of the interesting things about London Health Science Centre and the program here is that it's one of the largest cancer programs in the province. In fact, we were the second largest chemotherapy centre in last year. We have over 170,000 visits planned this year, and almost 8,000 new patients will be coming into the centre for treatment.
Patients here benefit not only from top-notch diagnosis, treatment, and care from expert health professionals, but they also benefit from the fact that this is a major cancer research centre, and that research is resulting in better treatments and higher survival rates.
We're getting better and better at treating people. They're living longer. That's really good news.
Good news, absolutely, but there is more to the story.
As a result, we've in some ways made the financial consequences and the impact on their family longer and more significant.
The financial consequences of cancer. Imagine facing cancer. You're fearful for your own life and the well-being of your family. Then, you are confronted with the financial consequences as well. It's a situation that Susan Goodrow witnessed firsthand. She was picking up medicine for her husband who was fighting lung cancer.
A very tiny woman came from the chemo lounge with her turban, obviously ill. And they called her name and she went to the counter, and the pharmacy person asked for $1,100. And the woman just stood there, very frail, and said, "I have no money left." Well, I stood there in disbelief because my husband, having benefits and financially, doing all right, had every comfort that was affordable to us, and still was going through hell.
Care and treatment of the patients is in fact paid for by the government. What most people don't understand or appreciate is the fact that there are direct financial consequences to patients because of the effort and the consequences of getting all this treatment. And so what we're finding is that 70% of our patients are reporting that they're suffering a financial burden from having cancer. In fact, 40% of them are reporting that that's significant to unmanageable in the amount of care.
A financial burden that is significant to unmanageable. Caroline Lott knows about this. She's undergoing treatment for breast cancer and living on about half the income she earned at her full-time job.
I'm Caroline Lott. I'm a widow. I have 2 sons. Sean's 23, and my youngest one is 15. He's Tyler. They're both still in school. I usually do a roast up for the day before I go for chemo. So this way, if I do a roast this big, right, it lasts me a good 2 days. And that way, if when I go for chemo, because I'm not going to be feeling up to cooking. So I do this up, and it's for supper tonight. The lunch is for the kids tomorrow for school, and then the rest of it's for dinner tomorrow night.
Caroline's treatment will run about 18 months, during which time she cannot work.
When I was first diagnosed, I was being such a worrywart as to saying, okay, when I'm done work, how am I going to support my family?
A support worker at the London Regional Cancer Program helped Caroline fill out applications for income replacement from government sources. That helped her make ends meet. But many cancer patients find there are even more expenses. For Barb Ward and her husband Mark, their priority was to keep life as normal as possible for their youngest son, 14-year-old Cody.
I had a really good income as well, and suddenly you go to nothing. And so you're without an income, but trying to maintain your lifestyle. I still wanted, Cody and all the sports and the activities. You want to maintain as much of a normal life as you can. You don't want to take anything away from them. I mean, that's what our lives are all about, really.
There's so many costs related to fighting this terrible illness because it's not something that goes away in a week. And the related costs can actually be a financial burden that's beyond anyone's income.
Fortunately, the hospital is able to help. Social workers are able to assist patients and families find resources that can help financially.
I would never be able to pay for this wig. It was over a $400 wig. And I just don't have that kind of money. And what's the price ranges between the human and the synthetic hair?
Well, I find the synthetics start around $320 for a handmade,
Right.
and about $200 for synthetic machine-made.
Beyond wigs and prosthetics, there are the costs of travel. More than half the program's patients come from outside the city, sometimes up to 4 hours away.
The research is now indicating that people are actually passing up getting care or getting the best care because of that problem. And so that's what's really bothering us. We can care for them when they're here. What's happening is they're not getting the best care because they're not getting here for the best care.
Imagine having to make a decision about whether or not you can afford the time and money to come to London.
They may have to come and stay over in hotel rooms. They may have to pay for the travel. They may have to pay for daycare to cover their kids back at home.
Not only does London Health Sciences Centre boast many of Canada's firsts in medical advancements, this centre can also boast a generous heart.
And the exciting thing for me is the development of a new fund that's designed to provide us with the ability to provide direct financial support for any cancer patient, regardless of what kind of cancer they have.
The Jean Goodrow Patient Assistance Fund began with memorial donations for Jean, an outstanding businessman who operated Goodrow Excavating in Tilbury, Ontario, and who passed away from lung cancer in April 2007.
I have personally talked to people that have financial burden while they're battling this horrible thing, and that's what they say. If only we didn't have to worry about that. All we would need to do is concentrate on getting well. But they don't have that luxury, and that's what we hope to give them.
London Health Sciences Foundation will steward the fund, and the support team at the cancer program will be the bridge for patients. The aim is to process applications very quickly, giving patients relief as soon as possible.
Been quite something to have the opportunity to be able to say to people, yes, don't worry about that. They're actually more anxious about the financial impact than the illness itself. It's such a relief.
If there's a way that, a person can take the stress of finances away from you and more concentrate on healing yourself, getting better.
I was shocked. I never dreamed that there was something out there for us that would help us. I always thought other people needed it more than me. But losing my income was a huge thing for me.
He will never be forgotten by his family, his kids, or especially his 3 grandchildren, who were the light of his life. He was very well respected, and I think he would like the idea we're doing this.